Hi, my name is Sonia Strunk, and this is Module 6 of the Psychopharmacology for Counselors. In this paper, I'm going to talk about medication noncompliance. Medication noncompliance is when a patient does not properly take their medication or doesn't take it at all. According to the World Health Organization, as many as half of all people do not take their medications correctly. Not only can medication noncompliance have adverse side effects for the patient, but it is also reported to cost the U.S. healthcare system over $290 billion in avoidable expenses every year. Not only that, medication noncompliance has caused over 125,000 deaths annually from heart attacks, strokes, and up to 23% of admissions to nursing homes, and is cause for 10% of all hospital admissions. Medication noncompliance can mean many things. One being that the patient is not taking their medication at all. Some are abusing prescription medication like opioids, benzodiazepines, and some are not taking these medications as directed. There are many reasons for medication noncompliance, and some of them may vary. Many times patients may be in denial of the issue. Diseases like high blood pressure or diabetes don't have any symptoms, so the patient may not think that they are in need of treatment of the illness. Some think that they must feel bad for it to be real. There are many other diseases that are asymptomatic. Even cancer, hepatitis C, will show no symptoms if left untreated. Without following the medication regimen, the consequences could be fatal. The cost of certain medications cause patients to be non-compliant. Some medications may not be covered under their insurance. Some medications could end up costing the patients hundreds of thousands of dollars. If the patient is low income or if the cost is out of their budget, they are likely not to pick up the medication at all. Another issue with medication noncompliance is that if the regimen is too complex. Some medications need to be taken with food, some have to be taken in the morning, some have to be taken at night. And if they're elderly and they don't understand these medications, the directions for them, they may not take it at all. Especially if they're on a variety of different medicines. So if they're taking 5 or 6 different pills and they all have different directions, they may not be following them correctly, or they may not even know when to take what to take. Another issue can be packaging. If the packaging is too hard for the patient to open. See, somebody with Parkinson's is trying to open a pill bottle and they can't open it. They're going to get frustrated and not even do it. So that is another reason. If the medication is too time-consuming, patients may opt out. Dialysis takes up many hours of a person's day. So if they don't have the time to sit through dialysis for 3 to 4 hours a day, then they may not do it. A lot of times medications may come with undesirable side effects, which may cause the patient to discontinue using. Some of the medications that help you, the side effects are worse than the illness itself. Sometimes medications can leave metal tasting in patient's mouth, nausea, vomiting, pain. I try to imagine the struggles of cancer patients to continue with chemotherapy, even though it's making them so sick. If a patient doesn't believe in the medication or believe that the medication is going to make them better, they are less likely to continue to try to take the medicine. They may give up and just not take it at all. Another medication issue is apathy. If the patient doesn't realize the importance of the treatment or does not care that the medication does not work, they are less likely to comply. If the patient has had a previous experience, they are more likely to happen in cases where patients have repeat or chronic illnesses. If a person tried a medication in the past and it didn't work, they're less likely to try it again. Another issue is addiction. Many patients are non-compliant because of addiction. They may start out on a medication such as an opioid, and they may take it as prescribed, but then they might find that it's not treating their pain as it once did, so they will take more and more, and then now the regulations on prescription opioids are so strict that the doctor may have to cut them off after a certain amount of time. Benzodiazepines are another one. They're very highly used. So any narcotic medication, amphetamines, all of those have a high non-compliance medication issue. There are risks for non-compliance medication can risk from little or no consequences to death or even jail. Sometimes if you're non-compliant, you're writing scripts for different doctors because to get more medication, you can end up in jail. Or if a person has a kidney infection and they choose not to take the medication, there's two options. It could clear up on its own, or it could turn into a more threatening issue such as kidney scarring, which can lead to kidney disease, high blood pressure, and kidney failure, which indeed will turn to death. Non-compliance with medications such as opioids, amphetamines, and benzodiazepines could result in an overdose. Lots of people now are overdosing more than ever, and a lot of the patients that I see are starting out as taking opioids from a doctor. So there's no one solution for poor medication compliance, but there are strategies and different techniques that a doctor can implement and the nursing medical staff can implement to help the patient. One way is to simplify the medication. If the doctor can have all of the drugs be taken in the morning with breakfast, that would probably be easier on the patient, instead of taking 4 pills 3 times a day, 2 times a day. If packaging is an issue, the physician can always call the pharmacy and ask for alternative packaging. Education is key, as in any field, education is key. If the physician just takes that extra bit of time and sits with the patient and understands, and have the patient understand what the reasoning for the medication is, how serious the illness is. If they understand the risk associated with not taking the medicine and the risk associated with the medicine, and tells them that any side effects that do come up, that the doctor can treat the side effects as well. Explaining to the patient what to expect. So you're not sending them home with, a medication that's going to make them vomit and not tell them that's going to make them vomit. Having patients set reminders, because forgetfulness is a big one with not taking their medication. So if there's an alarm going off, maybe the patient will be more understanding to take their medicine at that time. There's also watches that can alert patients when to take their medicine. Phone alarms can be set. There's pill bottles also that can come with an alarms. If the doctor just takes the time to pay attention to the patient's lifestyle and understand where their struggles are, maybe he can find a remedy so that it will be easier for them to take their medication. I think it's simple for the doctor just to spend that little bit more of time with them, and maybe that will help the people that can take their medicine on a regular basis and understand why. That's all. Thank you.